I grew up in a very small town in the Texas Panhandle named Memphis. I was born and raised in Memphis, graduated high school from there, decided that I would go to college and go do what I wanted to do forever since I was a little girl, and that was nursing. My thought was I would go to school and then everything would fall into place. I would meet someone, have children, live happily ever after. That didn't happen, so I wanted to be a mom. I decided the only way to do that was to adopt a child. Her name was going to be Savannah Grace. That was just, I don't know why, I just thought it was a beautiful name and I was going to have a beautiful child, of course. Then it all changed because I met Cuberto. And once I did that, it was a whole different story from there.
I came to the States when I was 21 years old. I had no money, no English, and I started working down, as a repair shoemaker. And then from there, I just jumped to a different position until I get a manager in a manufacturing plant in Chicago. And then I moved to Oklahoma City, where my sister lives, and that's where I met Rhonda.
He called me the weekend, and I said no, never accept a date the night before. So when he called me, I told him no.
She keep finding excuses for not to go out, and I keep putting like, let's go, it's just a night, it's just dinner. And after a while, she keep persisting. She said yes.
And we just knew that we were supposed to be together. So we met in March on the 7th. We were engaged in June and we were married in December. Then the following April is when we were pregnant with Savannah. So it went very, very quickly. I can't remember, about the 4th month that I was pregnant, they offered us the genetic testing and we declined because we decided no, it doesn't matter if anything's going on with the child or not. We're not going to end the pregnancy, so we'll take the child however God gives us the child. It was a very uneventful labor and delivery, and it wasn't until she was a few days old that we thought something might be wrong because we couldn't content her. She cried a lot. Pretty much she cried all the time. Epilepsy affects all of the systems in the body in various ways. You have a myriad of problems with a child with epilepsy that people just don't know.
It was very difficult to digest the idea that we're having a daughter with that type of diagnosis, and having the idea that we are going to be dealing with seizures all her life, and we don't know how she's going to be developed.
One afternoon when I got home from work, I was rocking her in the rocking chair and she stiffened. And I, as a nurse, knew exactly what was going on, but I, as a trained nurse, knew not anything about what to do. My knowledge, my medical training went out the window. As a parent, I was scared. I was at home alone. He was at work. She was seizing. She wasn't stopping. I didn't know what to do. I got on the phone to 911, and I couldn't think straight. My brain was rattled because at that point I wasn't a nurse, I was a mom. And this mom did not know what to do.
Hi, Savy. Hola, gordis. ¿Y si estás durmiendo? ¿Cómo le fue la escuela hoy?
She has many doctor's appointments. She has follow-up appointments. She goes to school, she comes home, she has therapy. That takes place almost every day. She has several different doctors, and because of that, we have several different appointments that go on all during the week.
We have visited different locations, different hospitals in different cities also, and that's very important for us to receive the care that she needs.
I still try to go in as a mom and not as a nurse, but I try to make sure that the things that are being done to her are the correct procedures. The doctors in Oklahoma City were few and far between for pediatric neurology. So we didn't have a lot of options except for just the few drugs that one of the doctors wanted to put her on. That drug made her scream and cry in rage. And so we knew at that point we had to do something different. And that's when we started coming to Dallas to a neurologist here. Knowing that Baylor is literally 7 minutes away from us is such a relief to know that we have IV access, we have doctors who know what they're doing, we have nurses who know what they're doing, and they do it with care. The doctor that we saw at Baylor that day told me in his words, I always listen to the parents because the parents are the ones that know their child. And when he said that to me, I knew, okay, this visit's gonna go great, because he was so willing to listen to what I had to say. After all of the ERs that we've been through and all of the hospitalizations that we've been through, these people are just small town people that are treating us like patients that they care about. And we're just not a number, we're really people.
Sometimes the smile when you go through the door and in emergency rooms can make a difference to us as parents, because we may be stressed out, and I think Baylor's is making a difference.
People say to us a lot, it must take a special person to raise a special child. And I say no, we were not special. She made us special. People tell us, how do you do it? And we say, because it's our daughter, because we have to do it. We're not strong. We're not any different than any other parent. We do what we have to do because she's our daughter.